All right, today we are diving into the science behind a natural compound that's showing some absolutely incredible promise in cancer research. And get this, its source is something you'd find in your kitchen. It comes from the simple peel of a citrus fruit. I mean, just think about that for a second. What if a part of something as common as an orange or a lemon could actually help us in the fight against one of our most complex diseases? Well, that's exactly what the science we're looking at today is starting to suggest. Okay, so to really get how we can fight back against cancer, we first have to understand its game plan, because it's not just about uncontrolled growth. Cancer has some pretty clever weapons it uses to survive and, more importantly, to spread. So cancer is sneaky. It's got these two main tricks up its sleeve. First, it uses this protein called galectin-3. You can think of it like molecular Velcro. It helps cancer cells get super sticky so they can clump together and travel around the body. And second, cancer is always hungry. It fuels its crazy fast growth by gobbling up heavy metals like copper. So it's got a way to stick and a way to fuel up. So what if we could throw a wrench in those plans? What if we could interfere with those strategies? Well, that brings us to our potential hero, an ally that comes straight from the orchard, Modified Citrus Pectin. So, what is this stuff? Modified Citrus Pectin, or MCP for short? Well, at its core, it's a type of fiber from the inside of citrus peels. But here's the game-changing part. It's been modified. Scientists have figured out how to break its molecules down into a much smaller size. And that's absolutely critical because it means it can get absorbed from your gut right into your bloodstream, where it can actually get to work throughout the body. All right, so we know cancer's got its weapons. How exactly does MCD disarm them? Let's break down how it directly interferes with the very pathways that cancer relies on. Okay, remember that molecular Velcro we talked about? Galectin-3? It's a protein that sits on the surface of cancer cells. It lets them all clump together and, really importantly, it lets them latch onto other organs far away from the original tumor. This whole process is a key part of metastasis, which is just the fancy word for when cancer spreads. And here's where MCP makes its move. Once it's floating around in the bloodstream, it acts like a decoy. It basically finds those sticky galectin-3 proteins and latches onto them. Now, because the galectin-3 is busy sticking to the MCP, it can't stick to other cancer cells. It essentially gums up the Velcro, making it way, way harder for cancer cells to stick to anything and spread. But wait, there's more. MCP has another trick up its sleeve. It's also a chelator, which is a really scientific way of saying it's like a magnet for heavy metals. It can grab onto and help your body get rid of toxic metals, including that extra copper that cancer loves to use for fuel. And what's really amazing is that the research shows it does this gently, without stripping out the essential minerals your body actually needs. Now, this all sounds amazing in theory, right? But what does the actual science say? Where's the proof? Well, the most consistent and honestly the most compelling clinical data we have for MCFP so far comes directly from research into prostate cancer. Check this out. In a clinical trial from 2023, this number just jumps off the page. Patients who were taking MCP saw their cancer marker doubling time, is called PSAD, increased by more than 4 times. So why does that matter so much? Well, a short doubling time means the cancer is growing fast and aggressively. So making that time 4 times longer is a huge deal. It suggests the disease is slowing way, way down. And that same trial found something else really powerful. Of the patients who started out in what's called an intermediate risk category, a whopping 77% of them actually improved to good risk after the treatment. I mean, that's not a small number. We're talking about more than 3/4 of these patients seeing a real, tangible improvement in their prognosis. And you know, this wasn't just a fluke. They saw this happen in more than one study. A similar trial back in 2021 showed the same kind of pattern. When you look at them side by side, both studies found these significant improvements in slowing things down and moving patients into lower risk groups. The effect seems to be pretty consistent. So the takeaway for prostate cancer is pretty strong, but you're probably wondering, what about other cancers? Well, researchers are on it, and while this evidence is a bit more preliminary, it definitely points toward a much broader potential. If we look back at an earlier trial from 2007, they were looking at patients with very advanced cancers. We're talking colorectal, breast, kidney, who had basically run out of other treatment options. And even in this incredibly tough group, about 1/5 of the patients saw their disease stabilize after just 8 weeks on MCP. And to really put that into context, one analysis said, and I quote, The data presented is fascinating when considering a fifth or more patients saw measurable clinical responses when no other treatments were proposed. In other words, when you have nothing else to offer, getting any positive response is a really big deal. And it makes sense, right? Based on what we know about how it works, blocking that Velcro protein and pulling out heavy metals, other studies are suggesting that MCP could be helpful for a whole range of cancers, including breast, colorectal, and kidney cancer. Of course, more research is needed, but the potential is definitely there. So let's pull all this together. What's the bottom line? The evidence is showing that modified citrus pectin, a totally natural compound, seems to target the very mechanisms that cancers use to grow and spread. Look, it isn't a cure-all, but it appears to be a targeted agent with really consistent data for slowing prostate cancer and very real potential in other areas too. And all this really leaves you with a pretty amazing thought, doesn't it? As science starts to peel back the layers on how these natural compounds like MCP actually work, it opens up a whole new world of possibilities. Now, of course, this isn't medical advice, but it's powerful information to have in your back pocket for conversations with your doctors. It really makes you wonder, how many other allies are just waiting for us, right there in nature's own medicine cabinet?